One of the latest new medical gadgets out there is aimed at helping people in rural areas who might not have access to specialized doctors. It's called telemedicine, and hospitals across the country have reportedly invested more than $2 billion this year alone, a number expected to triple by 2012. Our Ryan Owens checked it out.
How are you?
Dr. Stephanie Woolley is doing her rounds at Baylor Medical Center in Dallas.
Hey Raymond, it's Dr. Woolley. I'm just listening to your lungs.
She's also seeing patients at a much smaller hospital 30 miles away, and she never left the building.
I'm Dr. Woolley. I'm one of the critical care physicians at Baylor Medical Center in Dallas.
How can she be in two places at once? Because of Bessie, a 5'4" robot that weighs 220 pounds. Dr. Woolley controls Bessie through the internet.
How are you feeling?
Feeling good.
Using a joystick, she can enter a patient's room, check heartbeat, even examine x-rays. If she needs a closer look, she can zoom in on anything from a patient's face to one of the monitors above the bed.
Well, physically seeing the patient actually is very valuable to me because I can gather a huge amount of information just being able to look at the patient that I can't do just speaking on the phone.
Baylor is one of more than 250 hospitals in the country using these types of robots. Each one can cost up to $6,000 a month.
Ultimately, there is a steep initial cost to have this technology here, but over time, it's going to pay for itself.
Seeing patients remotely means fewer transfers by ambulance and helicopter, and it gives patients in rural hospitals access to specialists they wouldn't see otherwise. Doctors at the Leahy Clinic in Boston treat patients on the island of Bermuda, while specialists at St. Joseph Mercy Oakland have 32 robots deployed across the state of Michigan to treat stroke patients. But at a time when patients are always complaining about doctors' bedside manners, is turning the doctor into a robot really the answer? Well, patients and doctors seem to agree this is not nearly as awkward as it looks.
It was different.
Did it feel like you had a real doctor here?
It actually did. I don't think it's any different than when you get online and chat to somebody on the internet, so, why not a doctor?
Maybe, but her family admits they were skeptical.
I thought it was weird, because instead of a person, it's a robot.
What was her maximum temperature yesterday?
Yesterday, I believe it was 99.8.
If you miss the days when doctors made house calls, welcome to the future, where your doctor could be hundreds of miles away. For Good Morning America, Ryan Owens, ABC News, Waxahachie, Texas.
And joining me now from hundreds of miles away, Dr. Paul Vespa, neurologist from Ronald Reagan UCLA Medical Center out in California. Good morning. Stop. Okay, that's close enough.
How are you doing?
It's good to see you. Thanks for doing this with us. How do patients tend to react, your patients tend to react to the robot?
My patients really like the robot. Patients and families really appreciate the face-to-face connection with me, being able to see me in the middle of the night or late at night, attending to their problems in a really rapid fashion.
Yeah.
It's a human kind of interaction.
Yeah,
really.
it is. I mean, even though it's your face on a computer screen, it does feel like I'm talking right to you. And for you, it's not strange to not have your hands and be able to touch a patient, to look directly at a patient?
Most of what we do is think about the patient, consider what the treatment options are, get visual information. I mean, I'm able to sort of pick up important visual clues like your skin color,
right,
your pupillary reactions. These things you can really do with the robot, and that's the critical piece, really.
All right, you got to show it off for us a little bit here. So come a little closer, sure, and if we can get this right, I will grab the, can you turn around there? I'll grab the
Sure, I'm going to turn
stethoscope
around here, and I'm going to get really close to you.
Okay.
And I'm going to go ahead and get
come
really
on
close
up
here.
All right, let me see. Yeah, we tried this out a little earlier. I have to put it on my skin, so forgive me for the wardrobe
sure,
thing here.
And so the stethoscope, you're able to put the stethoscope on your heartbeat, And remotely, with the use of a little auditory device here, I can listen to what your heartbeat looks like, sounds like, and I can see whether your heart is regular, whether it's racing, whether it has any kind of abnormality. And really, this is the direct connection to the patient. There's really no substitute for really connecting with your patient.
So I think we're hearing my heartbeat there. Could you hear it? Am I okay?
Yeah, I'm listening to your heartbeat, and I think it really sounds pretty good. And you're nice and calm, and that's great.
Now it starts racing as you say that.
Yeah.
You can also, I know you can also look at x-rays and scans and things like that. Show us that real quick, like a CAT scan
Sure.
you could look at for a patient?
So this is a CAT scan of a patient, and this is a patient who has had a hemorrhage here. And what we can do is actually show you what the hemorrhage looks like. We can talk about different kinds of surgical techniques when we can go in with an endoscope and take out that hematoma. And there isn't a mystery by saying, well, you have some kind of blood in your head and the person is sort of wondering what you're talking about. Right. Really, there's nothing to really wonder about anymore. You can see it's right there.
You see it with your own eyes. Dr. Vespa, it is, for lack of a better word, very cool. Thank you so much. And I know it's very important providing medicine to people far away. And we'll be right back.